ADHD is a neurodevelopmental disorder that manifests itself in several aspects common to all age demographics from childhood to adulthood. It is characterized by a complex interplay of genetics, environment, and neurons that fails attention regulation and impulse control as well as hyperactive behavior. ADHD, as a rule, extends into adulthood, though the symptoms may well acquire a different form than they are in childhood. It is essential to understand how ADHD manifests among different life stages to provide diagnosis, intervention, and support. Therefore, if among those numbers you have been already diagnosed with the condition or someone you know and care about might be suffering from it. First, what is seasonal depression? Through our deep dive investigation, we will discover all the mysteries that surround this condition. So, readers, please stably adjust your seat belts, because in this voyage we can ask you for some love.
In the early stages of life, ADHD is usually brought out through three symptoms that are constant lack of focus, hyperactivity, and impulsivity. In the majority of cases, these symptoms show up when students have just started school and there is more tension associated with remaining focused on something in hand and resisting immediate desires which tend to be different later in life. One more significant characteristic of ADHD in childhood is hyperactivity, an externalizing type of activity that includes excessive motor activity and restlessness. ADHD kids could appear as in constant motion. Sitting still for longer periods seems to be impossible for them, while tapping or fidgeting is common as well. Being an outgoing and adventurous individual, this kind of behavior may cause disturbances in classrooms and social gatherings, in which it is difficult to form and maintain friendships. Impulsivity is the third cog of ADHD in childhood. Here we enter the realm of doing things without thinking, or, more colloquially, getting on with it, regardless. This propensity to behave without taking time to contemplate the possible consequences is evident in children with ADHD who tend to call out the answers in class, interrupt others, and hit the ball before looking where it's going, features that decrease their popularity in the playground and increase the likelihood of their attracting the ire of the classroom's authority figures. As well as fueling social difficulties, impulsivity increases the possibility of accidents or injury.
By adulthood, these symptoms can shift subtly to reflect the different demands and responsibilities of adult life. In adolescents and children, overt hyperactive behaviors can continue to present as their symptoms start to manifest, but as they get older they often lose their relevance. Children who run up and down the table will become adults who squirm and fidget in their seats. The classic presentations of symptoms, inattention, and impulsivity routinely continue into adulthood, though usually in more subtle forms. Adults with ADHD may struggle with keeping appointments or finishing selected goals because of a failure to concentrate for a long period, or because they consistently struggle with making a plan. Lack of attention is the most common problem for the ADHD adult in all areas of activity, at work, in relationships, and at home, in fulfilling commitments and completing tasks, drifting along by too many competing demands or changing objectives, suffering chronic procrastination and ever-tightening deadlines. Impulsivity, though, has an enduring influence on one's life, and as children become adults, impulsivity can reveal itself in ways with sometimes serious consequences in more complicated social and professional landscapes. Adults with ADHD may find it hard to control their impulses on the interpersonal level, blurting out an inappropriate comment or answering a perceived slight with an equally sharp retort. For professionals, impulsivity could mean struggling to stick with a company's protocols, making an impetuous financial decision, or indulging in a risky activity. Besides, emotional sensitivity and fluctuations in mood are often experienced by adults with ADHD, in addition to compounding their plight in social relationships and handling everyday stresses. They will bash between periods of hyperfocus and boredom, which may make it hard for them to concentrate properly and have a consistent level of involvement in their activity. This overall distractibility due to the inability to settle on a certain activity can create feelings of inconsistency and doubt that taking away the stress of handling ADHD in adulthood is further complicated.
While ADHD, attention deficit hyperactivity disorder, represents some complications in living, the person actually can succeed in the framework of understanding and reliable support. One of the crucial things in keeping time and consistently reducing feelings of overload is establishing a routine and structure. The strategy should include splitting up tasks into smaller chunks and using tools like planners and alarms for the organization. Meditation and therapy can also be a valuable tool for expanding self-awareness and learning effective coping skills. Digging into people, the fact that they can do whatever they want and they are good at something increases self-confidence and keeps them motivated. As for relatives and friends in the support group, education and empathy do matter. Learning to recognize ADHD as a neurodevelopmental condition, not a weakness of character, is crucial. Constructively recognizing the small successes by giving encouragement and praising increases self-efficacy. Transparency about the expectations and limits, and steady and regular environment design are the cornerstone of such an environment. If strong sides are identified, an environment of understanding and the sights of always being supportive is created, and ADHD and their loved ones can walk together.
Creating a routine that will work for ADHD sufferers is like designing a map of their day. All of these components of this routine are equally indispensable for them to stay on track even when they feel distracted or want to do something impulsively. Here is a glimpse of a typical day for someone with ADHD. At the moment, when the sun begins its ascent, they wake up at the same time every day. They could stretch a little or do some deep breathing to activate their body and mind. Next, they have breakfast, which they eat, trying to eat something nutritious to stay energetic the whole day. During the day, they have a schedule of what they need to do. They realize that they have better concentration in the morning, thus they begin with their most demanding tasks. They segment the challenge into smaller pieces so that they can manage them comfortably. They use timers to be on schedule and take a short break if they need one. In the afternoon, after having lunch, they can get a little bit exhausted. This is normal, so they decide to do more manageable jobs at this time. They may use some time to walk around or go outside to uplift their mood and energy. Then, they begin to relax their body. They summarize what they have done before and prepare for the next day. They will spend a little time doing things they love, such as book reading or listening to music, before going to bed. By this, it is possible for patients with ADHD to feel more organized and less stressed. If they have a plan, they could be flexible sometimes, but it will help them to feel more in control. Just as they have a map to guide them through the ups and downs of life, it feels like it. It is hard to diagnose ADHD on oneself, and this should not be done. Attention deficit hyperactivity disorder is a neurodevelopmental complication that requires a thorough examination by a trained medical practitioner to accurately diagnose and determine the appropriate treatment. However, there are some signals and features that an individual might notice in themselves which might indicate ADHD. It is of utmost importance to approach such warning signs with caution and turn to medical assistance for an accurate diagnosis.
A short attention span that is not related to tasks that require staying concentrated and focused is a symptom frequently seen in ADHD. People with ADHD often find themselves constantly distracted by outside stimulation or internal thoughts, resulting in frenzy shifting in focus and the inability to complete tasks. With such problems, they can easily lose track of things, misplace items, or miss appointments due to low planning and management abilities.
Hyperactivity is another common trait of ADHD and may show up in adults differently from children. Although kids with ADHD may show outward physical restlessness and fidgeting, adults might be experiencing inner mental restlessness and a feeling of their mind constantly running. They can be affected by the inability to unwind or concentrate when they focus on varying things at the same time. As one of the signs of ADHD, Impulsivity involves performing certain actions without thinking or the consideration of consequences. ADHD adults may encounter impulse control issues in different spheres of life, for example their relationships, monetary decisions, and driving. They might show deficiencies in behavior inhibition and will therefore experience problems in social and professional life. Besides, other presenting symptoms of ADHD in adults may include forgetfulness, consistent procrastination, difficulty in the completion of tasks, chronoshifts of emotions, and inclination towards risks or changes. While these symptoms are representative of ADHD, a definitive diagnosis should not be based on this alone, as they may be present in other mental health disorders or normal behavioral variances. However, one must not deny the fact that, in addition to these insurmountable challenges, persons with ADHD are gifted with talents and strengths that are unique to themselves. A lot of the young people display their creativity, ingenuity, and perseverance which determine the direction in which they would go when solving their problems. If the right professional resources, such as therapy, medication, and structural modifications, are available, people with ADHD can develop their strengths while ensuring their symptoms do not take over. Hence, society, through promoting acceptance and understanding, can develop an environment that is interactive and composed of individuals with ADHD across the lifespan with diverse needs. And we finally arrive at the last scene of the video. Let me say thank you for your downtime with us. Okay, now you need to press subscribe and hit the bell to make sure that our voice is heard by hundreds of millions. So please join us in extending this bit of kindness, waiting for us till we see you again.